At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. We are kicking off Pediatric and Rare Liver Disease Month. And so you'll be seeing me wear all manner of stripes and checks and things to help represent our rare colleagues and issues. We are so excited to be able to shine a spotlight on the issues of parents and pregnant people as part of our discussions in liver disease. I don't think we usually talk about these things. And with me, is Donna Cryer, founder and CEO of the Global Liver Institute and liver transplant recipient. I have the privilege of being the host for these shows and conversations. And I have with me Dr. Guadalupe Manrique Maldonado, who is an ambassador for ICP, and we will tell you what ICP is, all the syllables, all the things. And then we have Colette Kenny-Verdes, who is a licensed professional counselor who works with women who are experiencing these issues in pregnancy. And so we will not retain the mystery any longer what ICP is and what it does and how it impacts people and why you need to know about it. I will turn the show over to you, ladies. Welcome.
Thank you, Donna, for having us here.
Thank you. Nice to be here.
Excellent. So, Guadalupe, what is ICP?
Well, ICP is intrahepatic cholestasis of pregnancy. This is a liver disease that affect pregnancy because during pregnancy, hormones can cause a dysfunction of the liver. Basically, it causes a dysfunction on the transport of bile acids, and this can accumulate in the bloodstream. And this is very dangerous, especially for the baby. In ICP Care is a nonprofit dedicated to raise awareness about cholestasis of pregnancy, and it offers valuable resources to patients and their families, especially evidence-based information to help them manage with the symptoms or finding healthcare providers that are knowledgeable about cholestasis and make this journey easier for them.
Fantastic. And Colette, tell us about your experience with these issues.
Absolutely. So when I was pregnant with my son, who will be 7 in May, I was diagnosed with preeclampsia at 33 weeks. And not everyone who has preeclampsia necessarily goes on to develop HELLP syndrome. However, I did. And so HELLP syndrome absolutely impacts the liver. I feel like I had a pretty unique experience in that it happened 24 hours postpartum, and I'm happy to tell more details about that because I think it's important for women and families to know the symptoms, because I did need to advocate for myself. The hospital staff was lovely, but I had been informed about HELLP syndrome and the symptoms, and so I'd like to share about that if possible.
Please do. You can start now. We love to decode all the acronyms. HELP sounds like something that needs to be addressed. If it's called HELP, I would think you'd want to do something about it. So what does it stand for, and what does it mean that people should do?
Absolutely. So I actually have it pulled up here, so forgive me because it's a lot to memorize. And I know it sounds like the word HELP, but it's actually HELLP. So it's hemolysis, it's elevated liver enzymes, it's low platelet count. And basically that's really what I was trying to navigate, right? So it was 24 hours after delivery, and the right side of the right quadrant of my body was hurting. And it really was like unlike any pain that I had ever experienced before. Because it was post-delivery, and yes, I had preeclampsia, there wasn't a lot of worry, I guess, about my condition, because it's a fallacy that the cure for preeclampsia is birth, right? And so there is no cure for preeclampsia, but you will hear that birth is the cure. But in my case, it really wasn't. So I had suffered for a few hours with this pain on my right side. My husband was in the NICU with our baby because he was a NICU baby. He was born premature. And finally, after a few hours, I just said, this does not feel typical to me. This really hurts. And in almost every appointment with my doctor leading up to my son's birth, they'll ask you, do you ever have pain in your right quadrant? And so I thought that it was odd that after delivery, I was experiencing this pain. And eventually I demanded to see my doctor. It's not really in my personality, but I was in pain and I knew something was wrong. It's really important to listen to your intuition, would be my feedback to moms and families. And so it was revealed through blood work that I had a very severe case of HELLP syndrome. It's quite a story, so I don't know if you want me to go on.
We'll come
yes.
back to that. Establishing that background is really helpful. It is really useful to people, because I think, one of the reasons why we're doing this episode and this whole series is that people think liver disease takes, decades to accumulate, and so only people 60, 70, 80 need to worry about liver disease, or it's only caused by alcohol, or it's only caused by by viruses and viral hepatitis, and nobody ever thinks about liver disease in the context of pregnant women and infants and young children, and so we want to make sure that whether you're in family medicine or primary care or obstetrics or gynecology, or just women thinking of raising families, that the same way that you're monitoring your blood pressure and issues like preeclampsia are starting to be better known, that monitoring your liver health also becomes part of the norm, so that moms and babies can be healthy from a liver health perspective. And some of these things that are going on, like itchiness or pain in the upper right quadrant, do have answers, do have causes that often people aren't connecting to them. In Guadalupe, what you do is connect a lot of people to those symptoms and conversations that they think that they're having by themselves, but really they should be having with each other.
Yes, that's right. On my volunteer work, I actually have seen these experiences. The way Colette talks about her experience is something that I listen or read every day. We have a very big community on Facebook for moms that have gone through ICP to cholestasis, but also for moms that think that they might have cholestasis. And Colette mentioned something very important, which is advocating for yourself and trusting your intuition or your gut. I think that one thing that is like very common is pregnant women that have been told this might be normal, or you shouldn't be that worried about, or it might be your anxiety, or you're exaggerating. Yes, we know that pregnancy is hard, that pregnancy comes with a lot of changes and transformation, but it's a life-changing experience. And I think we should change the narrative from this might be normal to everything may be a sign of concern. And if we don't see that, then we cannot prevent. And for things, for some diseases or some conditions, such as cholestasis of pregnancy, we cannot actually prevent it. We cannot prevent it from happening, but we can prevent fatal outcomes, which is, for example, stillbirth. And how do we do that? Paying attention to the patients. And I think that's very important in saying that to every mom, like trust your gut, advocate for yourself is very important.
I we walk a fine line between making sure that people do know about the possibility of very serious outcomes like stillbirth without scaring people. And so but I think it's important for people, and that's both doctors as well as families, to be aware of the seriousness, because I have been in situations with just say friends and family members, where there were these indications during the pregnancy, a baby born jaundiced, and a family member coming in the room and saying, well, all babies are jaundiced, and or all mothers experience this. And I was like, that's not the case. And there's a family history of liver disease that might make you also want to explore this. And they did, based on that advice, that countervailing advice. And the mother was diagnosed, and then the child went through some weeks of light therapy to reverse the jaundice, and both were very healthy. And then the mom going into her next pregnancy was better informed, because the symptoms did come again with her second pregnancy, but she was much better equipped to bring it up with her doctor and to be treated. And so, she has 2 healthy children. But without that knowledge, you don't know, you don't want to know. So I think that we can do a much better job of making sure that these issues are appropriately characterized and put forward as part of the normal sort of pregnancy package of things that you need to think about. When you have brought this up, or you have discussed this with people, was there sort of pushback, stigma, negativity? Colette, in your own experience, were you believed, or and then I'll ask Guadalupe, you as well.
So that's a really great question. I want to start off by saying that the doctors and nurses who took care of me, with the preeclampsia delivery, and as well as the NICU nurses, I mean, they were amazing. They were top notch. So I really need to give credit where credit is due. However, there was one nurse who was on duty, so this was like an extremely important moment. And I do think that, she was giving me like gas X, I think she was just trying to placate me, so to speak. And because HELLP syndrome is really rare. I looked at it the other day. I think it's 8% of pregnancies. Correct me if I'm wrong. And as rare as it is, I have to say, I know 2 other women pretty well that have also had it. So it's rare, but it's also really important. I can't fault the nurse. She probably did think I was an anxious mom, but I do think it's important to inform the nurses and the doctors, because I went on for hours like this. Had my husband been by my side, I think it would have been resolved a lot quicker. But like I had said earlier, he was in the NICU. So I needed to rise to the occasion, and I did. I will say, though, before that, I had what I thought was a headache, but it was not a headache. It was actually my platelets dropping extremely low. And I'll talk later about what the headache was revealing. But my feedback for moms as well is, if anything seems out of the ordinary, if you have a headache that is the most extreme pain that you've ever felt, say something. I did not. I wanted to be with my baby in the NICU. It was my first time being with him since he was born. And unfortunately, it coincided with this pain. And so I didn't say anything about that. But the liver pain a little while later was just too much to ignore.
I feel for you. I want to, I am often, the friend that people call to come and sort out issues in the hospital for them and stuff like that. And so I just feel myself transported to that situation. I was like, I wanted to tell you, I'm like, no, we need to do something about this headache. And I wanted to intercede so much in real time for you. So Guadalupe, are these things that you hear from your Facebook group, from the patients that you work with, the moms that you work with?
Yes, I unfortunately I can relate to that situation too, personally and through other stories from the people I know. In my personal case, I woke up one day. I was 30, almost 37 weeks pregnant, and I woke up with my hands itchy and my the soles of my feet itchy too. This is a very particular symptom of cholestasis of pregnancy.
Mm-hmm.
This is the symptom that is very common. Although itching can extend to your body or appear on some other parts, and it can also resemble or can also be a sign of cholestasis of pregnancy, the
Mm-hmm.
itching in the palms of the hands and the soles of the feet, it's very particular. So I
Right.
called the nurse because it seemed to me very weird,
Mm-hmm.
and she said, "Oh, it might be normal, but just so you have peace of mind, I will make you see the doctor,
Mm-hmm.
in the next week." And I had to wait. I have to wait for other 4 days, and of course I did my research, but
Mm-hmm.
I have to say that I was very fortunate because everything went without a you know I had to endure the itchiness during some nights, which was horrible. But my baby at the end of the day was good, and I had an emergency delivery, and it was okay. We all were fine, but unfortunately, this same story has happened to other women,
Right.
and the outcome was totally different, and that's very sad. That because of this piece of information in the fact that they didn't advocate for themselves because they believe that what they were told that it might be normal, they they didn't push it, they didn't push, and they didn't say no, I want to go sooner, or I should rush to the emergency room and go to triage, or you
Mm-hmm.
know and that can make a big change. I was fortunate, but unfortunately many other women
Right.
haven't had
Mm-hmm.
that.
I have, a type of rare cholestatic liver disease where, itching of the palms was, one of the symptoms and ultimately it became an overall, just very severe, what's called a pruritus. And, I had some aunts who were like, "Oh, that means somebody's gonna visit you. You're gonna be traveling soon, or in this palm, your money is going to come." And so there are all these sort of folk tales about what itching in the palms and things would mean. And so that's why it's so important to. If these really persist and become things that interfere with your sleep and you become increasingly agitated, that you really do need to take seriously, call your doctor, get blood work done. There are treatments, for this. There are further treatments in development for this, and most importantly, being able to understand um, any other underlying liver issues that need to be dealt with, so that you can be healthy and the baby can be healthy, then and long term. And so these seemingly sort of simple or merely annoying um, signs can be very serious. And so the stories that we tell ourselves or that we tell others about some of these things that happen in pregnancy need to change, and they need to become more based in medical science. So, what are some happy moments in the advocacy work that you've done or in the counseling work that you've done? Is there any happy moment? Any healthy baby born is a happy moment, but any situation where this information got an aha moment or changed the trajectory of things, it'd be great for people to hear, so that they have hope and are encouraged in their advocacy. Guadalupe.
Yeah, of course. I think the best moment is when you're able to help someone like someone
Mm-hmm.
you actually have like a strong emotional bond, your friend, your cousin, And also, in the case of cholestasis, we know that there is a genetic component. So it's very important to alert your sisters, your family in general about this, because it can also be present in their pregnancies. But one thing, as a volunteer and as a volunteer, as an ACP Care ambassador, is helping people to understand what they're going through, helping people to advocate for themselves, helping people to look for the right resources or look for the right healthcare provider that can actually help them to manage their pregnancy. That's just a great feeling. And it really feels really good when these people come postpartum and they share pictures of their babies and they say thank you, because it's not only the all the resources and the support and the information, it's also this mental support, this emotional support of other women that know what you're going through, and that's very valuable.
I think that's exciting. So
Yeah.
Colette, some highlights
Yeah.
from you?
So I'll just share that, counseling is a second career for me. So I'm really launching, working with a private practice in Pennsylvania. And my passion really is to help women who have suffered miscarriage or, perinatal loss, have experienced preeclampsia or the NICU life, and really grief in general. So I'm just really kind of springboarding with that. And I do have the, I guess, tragic privilege of working with a few clients right now who are pregnant, have pregnancy after loss, and how exciting that can be, but also, still navigating the grief from, previous pregnancies. So I'm hoping that there will be some continued good news as their pregnancies, progress. But I will say this, and I am trying to squeeze in my headache story because I think it's really important. I think my own story and the fact that my son will be 7 is a huge success. I have had professional and personal connections, like Guadalupe said earlier, where almost the same exact situation as me, and unfortunately their baby, did not live. And I've also read, in the media, same exact situation as me, and the mother did not live, right? So as much as there was trauma for me, it was also a happy ending, right? My son is thriving and I am able to, be alive and be his mom. I'll just say to anyone who's listening to this, who's pregnant, or if you have pregnant people in your life, please take that headache seriously, whether it's while the woman is pregnant or, in my case, postpartum. I turned the HELP syndrome around after 48 hours, so to speak. I got out of a very dangerous situation, but 3 weeks later, 3 weeks postpartum, I was experiencing stroke-like symptoms, slurred speech, numbness in my body, and I had a gynecologist who said, "You're getting an MRI." So it wouldn't necessarily be like you wouldn't think that postpartum that women would need an MRI with HELP syndrome, or even if you were not diagnosed with HELP but you had a headache. Please get the MRI. And I know that they are extremely expensive if not covered, and I hope that they are covered. It revealed that I had bleeding outside of my brain from the HELP syndrome. My platelets had dropped so low that it's called a subdural hematoma. They were able to then treat me with steroids. I've had subsequent MRIs. Everything's fine. You can imagine how scary that was for many reasons. And they also put me back on magnesium at some point to avoid stroke. So while there's no cure for preeclampsia and HELP, there can be measures to save moms and babies. So I just urge everyone to, I know it's not easy, right? Everyone does not have equal access to healthcare or insurance, right? An MRI could be thousands of dollars. And so I recognize that's not always possible, but I hope that we're headed in the right direction where it is.
I think I draw a couple of things from that. So one, kudos to you for believing in yourself to bring the issue forward. And kudos to your doctor for taking it seriously and referring the right type of testing, to making too many sort of calculations about what people can access and what people can afford often keeps doctors from making the referral and making the prescription. And so I think we need to deal with everything sort of step by step. It also seems to call to the need for you know, maternal fetal care insurance coverage to not just sort of drop off precipitously right after the birth. That there's a very important and often far longer postpartum period. Some would say, you know, a year after birth, in which it would be completely reasonable and in everyone's best interest, particularly if we are having more women have babies, whether they want to or not, that we should make sure that they have insurance coverage for the full postpartum period, so that issues like yours that happen weeks after, or things that happen 6 weeks after, you know, depression, physical, emotional, things with lactation, things that really influence whether they're able to have another healthy pregnancy, you know, of their choosing, all really should be considered in this period of time. We know that women of childbearing age are at higher risk for many different types of liver disease, certainly by definition, intrahepatic cholestasis of pregnancy, but many of the autoimmune liver diseases really do manifest in younger women of childbearing age. And so the attention to liver health and provision for coverage so that people can access all of the service, not just the things that we sort of normally prescribe to a very limited set of supposed prenatal services, need to be considered so that women and children and their families can be whole.
Absolutely. It's not lost on us that at that particular moment in time, at that particular position, my husband had amazing coverage, which enabled us to go through even the NICU experience without having that as a burden. That would not be the case today in our current positions, but like I said, it was just that moment in time. And I can't imagine having to have navigated the medical and also just the emotional side of the whole situation, NICU, preeclampsia, HELLP syndrome, if we were then, you know, burdened with, which could have been, I mean, I can't even imagine how much the bills would have been with a 4-week NICU stay. So I feel like we were really fortunate in an unfortunate situation. And yet I recognize that's not the case for many families throughout our country. And so that's definitely an area that I want to do advocacy work in as well.
Yeah, we come right on board. We have
okay.
Awesome. We have you drafted. We have a place for you.
Excellent.
So Guadalupe, do you have you know, parting thoughts or recommendations for how we make this better in the future?
Yes. I think you mentioned something that I would like to talk a little bit more. You mentioned something about how we don't want to cross the line between, you know, warning and make the whole experience scary. And I just want to mention how difficult this is with intrahepatic cholestasis of pregnancy, because I think it's important. In my own experience, when I was diagnosed with cholestasis for a second time, because cholestasis, it's there is a high probability of have it in a second pregnancy if you had it once in your first. In a subsequent pregnancy, there is a very high probability. So I was diagnosed this time earlier. The first time I was diagnosed at 37. This time I was diagnosed at 35 weeks of pregnancy. And the fact that I couldn't foresee that my baby was in fetal distress and that I was caught by a non-stress test that is common. It's a common management of cholestasis of pregnancy. That was very scary. Like the fact that you cannot foresee if something is actually happening with cholestasis of pregnancy. But here, that is the reason why the proper management of cholestasis is important. I have heard of many pregnant moms that don't go to non-stress test, which is a way of monitoring your baby, how is the heart rate of the baby.
Mm-hmm.
And I was during this one of these non-stress tests that um, my healthcare providers realized that my baby was on fetal distress, and then I was urged to the emergency for an emergency labor induction.
Wow.
And yes, it is very scary to think about it, and we don't want moms to be scared of these things, but at the same time, it's what can prevent a fatal outcome. And I think that if we advocate more for healthcare providers to be informed about what is the best way to manage ICP or cholestasis of pregnancy, we can make moms also feel more calm about it, and they can have more resources to go through cholestasis of pregnancy without having this big stress, which was what happened to me. During my whole pregnancy, I had this fear that my baby was going to die and I wasn't going to be able to do anything. So there's a lot of things here that I may be having all of these thoughts, and I want to put together. It's very important to be also taking care of the mental health
right.
Of the
well,
mother.
now our good friend Colette can help us with that. And I think that's very important. I've worked with entrepreneurs who had a family experience and wanted to help moms do better, and it was very prescient pre-pandemic to want to be able to send electronic scales and different things home with women so that they can better monitor and have data flowing into their doctors even between visits. And so this is one of the issues that I'm going to bring up with them. Can we help women through increasing numbers of electronic devices and data streams have a better sense of control, so they can be calm and enjoy their pregnancies and are empowered to do their part to have the best outcome. So more to come. As I say, with so many of these conversations inform GLI's agenda on how we are, truly impactful and do meaningful things for patients and families. And you two have been so helpful today in setting that direction and that agenda. So I thank you both.
Thank you so much.
Thank you so much. Yes.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.